The iPro QIN presents COVID-19 Vaccine Success in a Nursing Home, a case study. Guest speakers: Mark Olson, Administrator, Kingsway Arms Nursing Center, New York. Melanie Williams, Infection Control Specialist, iPro QIN former Director of Nursing, Long-Term Care Facility, New York.
My name is Ruth Welch. I'm a Senior Quality Improvement Specialist here at iPro Quinn QIO. I'm a registered nurse with over 40 years of healthcare experience, which I brought to iPro 8 years ago. Here with me today is Melanie Williams, who recently joined iPro as our Infection Control Specialist. Melanie, would you like to please tell us a little bit about yourself?
Sure. So over the last 8 years, I've been working as a director of nursing and long-term care. I did work through the COVID pandemic and supported a vaccination campaign for COVID-19. Prior to that, I am a registered nurse with a master's degree in infection control and epidemiology.
Great. Thank you, Melanie. Well, we're here today to talk about the COVID vaccination program, and we're happy that we do have a nursing home administrator with us from a skilled facility here in New York, and he's going to be talking to us a little bit about his successful program. Today, our guest is Mark Olson, nursing home administrator from Kingsway Arms here in New York. Mark, would you please be willing to share a little bit about yourself?
Sure, Ruth. Thank you. So I've been a nursing home administrator for just over 32 years. For the last 13 years, I've been the administrator here at Kingsway Arms Nursing Center in Schenectady. We're a skilled nursing center with 160 beds. And I'm also very involved in our state and national trade associations where we get a lot of our information on operations.
Great. Well, let's dive into our conversation regarding COVID vaccines. So, Mark, would you mind sharing your current rates of resident and staff rates for your COVID vaccine at your facility?
Sure, I'd be happy to. We're currently at 98% vaccination rate for our residents. And the reason we have two residents, one who received one dose of vaccine and decided not to get a second. And we have one new admission who has not been able to be vaccinated yet, and we'll probably be vaccinated within the next day or two. From a staff perspective, we currently have 83% of all of our staff, including even per diem staff, who have been vaccinated, and so far we're pretty happy with that number, although every day we're trying to increase it to get as close to 100% as we can.
Wow, and that is great, outstanding actually. Now that you've piqued my interest and maybe some of those who are listening, can you tell us how you prepared to have such a successful program?
Sure. The most important thing for me was knowing that this vaccine that we've been waiting for, again, this goes back to December. We've been waiting for this for so long as really the answer to get out of our current situation with coronavirus. So it was really important for me to educate myself and my leadership team on the vaccines and what they were all about and how they're going to really be the game changer that we were really been looking for to get back to any sense of normalcy in the nursing home that we operate.
Great.
Education of myself and the leadership staff was really job one.
Good. Melanie, as a previous role as a DON, was there something at your facility that you did to prepare for the vaccine program?
Yes, I started rounding early before the vaccine was even available to start hearing what the concerns of the staff was. And we provided a lot of education to the leadership team as well. So the nurse managers would have staff huddles, have conversations. We really wanted to hear what the staff was learning. And so we could be the myth busters. There's a lot of myths that were out there, and we wanted to hear what their thoughts were, get the evidence, and bring the science forward to the staff. I think that was crucial in changing people's minds and giving them the information and trying to kind of pinpoint those naysayers to really have one-to-one conversations with those folks.
Were there any key messaging or slogans that your facility used during this time, Mark?
There weren't any real key messages and slogan. I mean, the theme was always educate and vaccinate. So that's what we really focused on. And we knew going into it, we knew there's going to be hesitancy. We've heard it through the media. Um, so we really focused on educating our staff on the vaccine, what it was all about, and really what our expectations were for them as healthcare professionals.
What message did you give to the residents and the residents' family regarding the vaccine program?
The resident population was a bit easier. They're from a population where if there was a recommendation for a vaccine, they were generally takers and they trusted the program and were not much of a challenge to educate. So, but we knew education was still important for that group. So we sent out a lot of electronic information by mailings on our website to educate our families. And again, we relied on our nursing staff to have conversations with our residents who wanted to hear more about it. And that's generally the way we provided that information. It wasn't a big lift for that group, again, because they were already pretty much on board when they knew it was available.
Melanie, with your experience, did you talk to the facilities as well, the residents?
Yeah, one
And
thing
family?
one thing we did, we initiated, as soon as visitation shut down, we initiated weekly calls to the families and loved ones with information about what was going on, information about their loved one individually. Was there a change? How were they doing? And it really improved confidence with our families because they had that one-to-one conversation weekly. And I think they had ample opportunity to ask questions, know what was going on next. With leadership support of emails, that was another opportunity to just follow
Mm,
up with those kind of conversations. It definitely drove confidence.
great. Trust too. It's
Mhm.
building that trust along with the residents and their families. That's great. Now, after you've done the educational sessions and they were completed, do you address any of the challenges? How did you address the challenges to any of the vaccine acceptance?
Well,
Mark?
just to actually maybe go back to a little bit from a resident perspective, one of the things that we were able to
Hmm.
do, because we needed to get consent from the resident and for the most part from their family members, their designated representatives.
Hmm.
So we were able to use our electronic medical record who had a document manager component to get electronic signatures for consent forms. And I think the ease of getting that done also contributed to the success we had on the resident side.
Great.
From a staff perspective, the most important thing for me was the mandatory education sessions that we had for our staff. We didn't mandate the vaccine, but we did mandate education. So myself and our medical director held, I think, a total of about 18 education sessions for our staff with a PowerPoint presentation that was provided by the American Medical Directors Association. And it really addressed up front a lot of the questions that they had and hopefully answered a lot of those questions. So we thought that was really productive and effective. But after that, it was listening to the individuals' hesitancy, what they're hesitant about, and try to address on an individual basis to answer the questions that they have. For many of them is they just wanted to wait and see. And so interestingly enough, on our second round of vaccination, we had a lot more staff participate who decided not to on the first one because again, they wanted to wait and see what happened to the first group of people, right? Because we were
Correct.
very early on in the vaccination process. The other thing that myself, I know some of our other leadership staff did, is we were some of the first folks to get vaccinated in our facility. We were able to get kind of early into a county program so that by the end of December, some of us had already received vaccinations. And then we were able to share that experience with the staff, both at the meetings and at any other one-to-one conversations that we had.
Now, if the staff wasn't willing to get that, even after the education, did you offer, is there something that you put a process in place if they still declined?
Yeah, so anyone who did not get vaccinated, we put in early on a declination form with a couple of check boxes, but it forced them to tell us why they were declining. And when we had that information, gave us the ability to then have the one-to-one conversation. So I think putting in a process early on, and this goes back to late December, of getting declinations forms from staff stating why they're declining. And again, the follow-up conversation was very important. A lot of minds we were not able to change, but many we did. And I think that contributed to our current 83%.
Melanie, did you incorporate any like peer-to-peer when you were at your facility? Any coaching for compliance maybe?
Yes, so I think it's really important to remember that not all staff are going to hear the leadership team. There are some staff that don't trust different people, but who they do trust is their peers. So if you can find a leader within the peers that people naturally go to, despite the topic, if they're on board with the vaccine, that might be the opportunity to have them be the champion for the vaccine. And that certainly helps. It doesn't have to be a CNA, it could be a housekeeper, it could be an activities director. It just depends on your facility and who people trust.
So did you offer any incentives to get the vaccine, or did you celebrate successes? And how did you do that with your program?
Yeah, I mean, here at
Mark?
Kingsway, we made an intentional effort not to incentivize people to get vaccinated. We thought, and we kind of took it as the approach is it's our duty as healthcare professionals to get vaccinated to protect themselves, their families, our residents, our visitors, and really we took it from that approach. And I think that was effective. The one thing that we did after someone was vaccinated, in fact, when they completed the monitoring session after they received the shot, they received a gift card for our Kingsway Cafe where they could go and get a lunch or a dinner. So it was a little thank you, not really an incentive so much. The other thing that we did is we took a lot of pictures during the process, and we shared those pictures throughout our digital display boards in the building. Staff seeing other staff getting vaccinated, and I think that was quite effective as well.
Melanie, what did you see at your facility?
Well, the day of the clinic was a celebration. People were ecstatic that the vaccine had finally arrived and that they could start to feel like there might be an end to the struggles, not only for themselves, but for the residents they're serving. These staff care about their residents, and it was a very exciting event. There was high fives and celebration.
That's great. So, Mark, my one question I have for you is, how are you continuing to with this vaccination program? And specifically, as you mentioned before, can you address the per diem staff, how you're addressing that?
Sure. Yeah, we took the approach with our per diem staff, and we really have per diem staff in two departments, rehab and nursing. So our director of nursing really took the lead on following up with the per diem staff in the nursing department. And I helped our rehab director address it with the per diem staff in her department. And for the most part, that staff received vaccination elsewhere. And the challenge was getting copies of that documentation. And again, that was a lot of just simple follow-up and phone calls to get the documentation in hand. The other approach we took is that, if we didn't have a documentation of a vaccination or a declination from a per diem staff member, they would not be on the schedule until we had one or the other. Again, a vaccination card or a declination form.
Any resources that you used to help that you felt that was valuable for your program, like posters, PowerPoints, anything like that you would think?
Yeah, actually, we partnered, our partner pharmacy was CVS, and they provided a lot of good information, including posters that we could put throughout the building. So those were quite effective. But as I mentioned before, during our in-service programs, our mandatory in-service programs for all of our staff, we used a PowerPoint presentation by the American Medical Directors Association for the presentations that I did. And our medical director made his own PowerPoint presentation to address more of the medical issues, the more of the non-operational type issues of the vaccine that people, I think, at that point wanted to hear more about. His presentations were a few weeks after I had my presentations, and really what we did is we kind of got the feedback from our staff after my initial presentation to see what was still left on their mind, what needed to be addressed. We determined it was more medically related questions, and then leaned on our medical director to have some follow-up in services.
Melanie, would you like to add anything related to like lessons learned?
Yeah, I just believe that we cannot lose track of our stories and experiences. The pandemic, for the individual facilities, I think we need to remember the impact to our residents and our families and our staff. There was a lot of losses, there was fear, there was pain. It's imperative to use your story to continue the vaccination efforts, remind people what happened, and continue getting people vaccinated.
Anything that you learned, Mark, with this, from your vaccination program?
Yeah, and again, this goes back to education and providing information, and what really dawned on me after we were into this for a while is it wasn't the more experienced staff that we had to provide more education to, because the staff 40, 50 and above, they don't get all of their information from the internet. They're still watching TV, getting newspapers and all of that. It dawned on me that it really is the 20 to 40 age group that we really needed to target our messaging to, because those were the staff that were more hesitant, that weren't just believers from the start that that vaccinations were a good thing. And that's where we're continuing our efforts to really address and sometimes combat the information that they're getting, which is very often inaccurate.
And like Melanie said, the personal stories of success and how they completed it is great. Well, I want to say thank you both for your valuable information. As I stated, iPro does also have the resources that are available. We do know that CDC has a resource for communication strategies for receiving the vaccine, and it includes a PowerPoint presentation and posters to assist with the reminders. So CDC does offer 6 strategies for building a COVID vaccine confidence among healthcare professionals, which Mark and Melanie discussed, really encouraging senior leadership to be vaccine champions, which they were, host discussions, which they did, share the key messages, and what Mark said is like educate to get vaccinated, and provide the information and resources. And I love the one-on-one aspect. I think that was really, really a key factor for both of you that you did. And the declination letter is actually telling you specifically in their own writing, basically, of why they didn't want to get the vaccine. And also to talk to non-medical staff, like you said, Melanie, it could be anyone, somebody who they trust within your facility, and then make that decision to get vaccinated visible and celebrate. And the pictures, I can just imagine when somebody sees their picture up there. That's great. And so really, this concludes our topic of conversation today. Thank you again, Melanie and Mark, and it was a privilege to have you on this discussion today. Have a great day.
You too.
Thank you.
Join us for more COVID-19 vaccine support. How? Contact Ruth Welch, Senior Quality Improvement Specialist, rwelch@ipro.org. Melanie Williams, Infection Control Specialist, mwilliams@ipro.org. Visit our website, qi.ipro.org. Follow us on our social media channels, Facebook, Twitter, LinkedIn, YouTube. This is a product of the collaboration between iPro, Health-Centric Advisors, and Clarent, serving as the iPro Quality Innovation Network, quality improvement organization for the New England states, New York, New Jersey, Ohio, Maryland, Delaware, and the District of Columbia.